Mahendra. My name is Shobna. I'll be doing your manual osteopathic treatment today. How are you?
Good.
Good. Okay, so what brings you in today?
I got my back pain and my left side knee.
Also, you have a left knee pain and a back pain.
Yes.
And do you feel the pain all the time?
Yes, ma'am.
And for how long?
Almost a year.
A year ago? Do you remember you did something to it, like an injury, or the pain just came on?
Just walk.
Just work?
Yes.
Okay, so working and then
Playing soccer too.
Playing soccer too brought the pain on? Okay, so how will you describe the pain? Is it like a sharp shooting pain or a dull achy pain?
Like dull achy pain.
Dull achy pain?
Yeah.
And do you feel the pain just in your lower back, or the pain comes from the lower back into your knee?
Lower back to knee.
Lower back into the knee?
Yes, ma'am.
Okay, and it's a dull achy pain.
Yes, ma'am.
Okay, on a scale of 1 to 10, 1 being less pain and 10 being the most pain, how will you rate your pain?
7.
A 7? Yes. And the pain is there all the time?
Yes, ma'am.
Okay, so what makes the pain worse? What do you do that makes the pain worse?
By bending and doing a little bit walk.
So bending and lifting and things like that aggravates the pain?
Yes, ma'am.
Okay, so what makes the pain feel better? Anything that makes the pain feel better? What do you do for the pain to make it feel better?
Or just acupuncture and
massage makes it feel better?
Yes, ma'am.
Okay, have you tried like heat or cold or anything on that makes it feel better?
I did, but doesn't work.
Doesn't work? Okay. So have you seen your doctor regarding that?
Yes, ma'am.
Okay, and what did the doctor say? Did you get any x-rays or anything done?
I got x-rays in my knees. It says arthritis in
So osteoarthritis in your knees, and what about your lower back?
Lower back, it's
nothing showed up in the lower back?
No.
Okay. So do you take any medications, any supplements?
No, ma'am.
Okay. And do you have any high blood pressure, cholesterol, diabetes?
No, ma'am.
No? Okay. Any family history of any conditions that I should know of?
Just my dad got a liver problem.
Okay, so he died. Did he die of liver problems?
Yes.
Okay. So, and another thing I'm going to ask is, how's your stress level? Do you carry a lot of stress?
Yeah, I do.
Okay, on a scale of 1 to 10, 1 being less stressed, 10 being the most stressed, how will you rate your stress level?
6.
A 6? And is it due to your work or family stress? What kind of stress?
Family stress.
Family stress? Okay.
Yes, ma'am.
Okay. And do you remember anything about your birth? Like, what is it, a natural birth, a cesarean?
Natural.
Natural birth? And
Yes, ma'am.
it was all like, it wasn't like a premature birth or anything, it was all on term?
Yes, ma'am.
Okay. And so no family history of any problems, right?
No.
Okay, so now I'm gonna do some assessments. So if you can stand up and walk up and down for me. So here we're testing the patient's gait. So we're looking at how the patient is walking. So we're gonna watch his arm movement and his leg movement and his hip movement and how his shoulders move. So looking at my patient, his glides are pretty good, except for that his feet is abducted. Okay, so now if you want to stand over here for me, I'm going to do an anterior view test for him. So I'm looking at my patient's eyes to see whether the eyes are leveled, whether his ears are leveled, his shoulders are leveled, his hips are leveled, the knees and the ankles, and the placement of his arms, which looks pretty aligned for me. Okay, so now I'm going to come on the patient's right hand side, and here I'm looking for the alignment of the patient's lateral view. So here I'm going to watch for his ears and his shoulders, whether the ears and the shoulders are in line, the hips, the knees and the ankles, which looks pretty aligned to me. And then now we're going to do the same thing on the right hand side. So we're looking at the patient's ears, shoulders, hips, knees and ankles, pretty much lined up. And now I'm going to turn my patient facing the wall. So we're going to do a posterior view. So on the posterior view, we are looking at the shoulder alignment. We are looking at the scapula, the hip, the knee. Here I'm observing a little bit of hyperflexion in patient's left side of the knee and a little abduction in his feet. Otherwise, the alignment looks okay to me. Okay, so now if you want to face me, and we're going to do some movements. So if you want to come all the way down and touch your toe, and wherever you feel pain, you stop. Okay, so all the way down, and then come all the way up. Okay, so if you want to put your hands on your shoulders and go on the side for me, and wherever you feel pain, you stop. And on the other side, come in the middle, and then rotate to the right, and then go to the left. Any pain?
A little bit.
Okay, so while we are in this position, do you want to move your arms for me all the way around, and then the other way around for me, and on the other side as well. Any pain?
No.
Okay, so now I'm going to have my patient face the wall. And here we're going to check my patient's iliac height. So if I'm going to roll your shirt up a little. If you want to move your pants a little bit down for me. That's good, thank you. Okay, so we're going to assess my patient's iliac height. So that looks quite level to me. And now I'm going to do a posterior anterior ilium. So do you want to lift your leg up for me? This leg up for me? Like in the front. Like lift this knee to your hip. Okay? All the way, like, okay, stand straight. Okay, stand straight. Okay, you can put your feet down. Okay, bend down for me. Okay, come back up and stand up straight. So looking at my patient's anterior posterior ilium, looks quite level to me. Okay, so now I'm gonna check my patient's upslip. So I'm gonna palpate the PSIS. Do you wanna bend down for me a little? Okay, come back up straight. Okay, now can you bend down? Come back up, back up. Okay, he doesn't have an upslip, so now I'm going to test the deep sulcus. Deep sulcus looks quite even to me. Do you want to go into bend down for me? And come back up. And come into extension for me all the way back. Okay, go into neutral. Okay, stand still. Okay, my patient doesn't have a deep sulcus. Okay, now I'm gonna check for my patient's side bending or rotations. It feels like my patient has a little bit of rotation on the right hand side and a little bit of side bending on his left. Okay, so now if you want to come into seated for me, let's sit over here. I'm going to put this underneath your feet. Okay, So if you want to put your hands on your shoulders and bend down for me as far as you can without any pain. Any pain?
No, ma'am.
Okay, go straight. On that side. Come in the middle. On that side. Any pain?
No, ma'am.
Okay, so now we're going to do some neck movements. In the front. In the back. On the side. Ear to shoulders. On this side. And then look over your shoulders. Any pain?
No, ma'am.
Okay, so now while I have my patient like this, I'm gonna look for, I'm gonna do the assessment. I'm gonna lift your shirt up, okay?
Yeah, ma'am.
So here I'm gonna check for the iliac height. Looks equal on both sides. Now I'm gonna check for the upslip. So PSIS. PSIS. Okay, do you wanna bend down for me? When my patient doesn't have an upslip, come back up. Okay, now I'm gonna test for the deep sulcus. Okay, go into flexion for me, or look all the way down. Patient doesn't have a deep sulcus, come back up. Okay, now I'm going to test my patient for rotation and side bending. Feels like a little bit of rotation on the right hand side, which starts right here and then goes all the way up to there, and a little bit of side bending on the left hand side. Okay. While I have my patient in this position, I'm going to test for some sclerotones. So I'm going to do some tapping, and if you feel any pain, let me know, okay?
Yes, ma'am.
So we're going to go into the ASIS. Okay, we're going to go. Any pain?
No, ma'am.
The next one we're going to do. Any pain?
No, ma'am. No, ma'am. No, ma'am.
Anything? No?
No. No.
Okay. So now I'm going to have my patient lying on his back. On your back, yeah. Okay, can you lie on your tummy first? Here we're gonna look, you can have your hand like this, underneath your chin. Here we're gonna look at any spider veins or anything like varicose veins or anything on my husband's legs, which I don't see anything. And I'm gonna do a thermoscan. I'm gonna test his body for any heat. I don't feel my client has any excess body heat that it's palpable on my hand. And now the next thing we're gonna do is, do you wanna come down a little bit for me at the edge of the table? I want your knee at the edge of the table. Keep coming down. Okay, right there, that's good. I'm gonna spread your legs a little bit. Is it okay if I move your pants down a little?
Yes, ma'am.
Okay. So in here we're gonna look for upsleep again. So PSIS. Okay, do you want to come up on your hand for me all the way back? Put your hands there on your chin and then just move up. Okay, go down. So there's no upslip. We're going to test for deep sulcus. Okay, do you want to do the same thing again? Come up. Okay, go down. I don't see any deep sulcus on my patient. The next thing we're going to do, check for is the depressed iliac lateral angle. I'm going to be coming down into your sacrum, okay? Do you want to come up on your hand for me? You want to come up? Go down. Do you want to come back up again? All the way. Do you want to come up a little bit more? Okay, go down. So my clients, DILA is even on both sides. So the next thing we're gonna check is his rotations and his side bending. Okay, do you want to come up a little on your... So there's a little bit of rotation on the right hand side. So there's a little bit of rotation on the right hand side and side bend onto the left. Okay, thank you. Okay, so now if you want to come on your tummy, you want to come on your tummy for me? And you want to put your hand on your chest. Here we're going to be looking for the cage, the cage movement. So I'm going to put my hands on your hands. Take a deep breath in and out. One more. So we were assessing for the cage to move up and down. Good. Okay, so now if I can get you to put your hands onto the bony part of your pubic symphysis. You okay like that?
Yes, ma'am.
Okay, so I'm gonna put my hands on top of your hands, okay?
Okay.
My client's pubic ramus looks normal, and now I'm gonna be assessing his out flare and in flare. I'm gonna be lifting your shirt up. I'm gonna come down into the pelvic area for you, okay?
Okay.
Looks equal, so no issues over there. So now I'm gonna do some passive movement of my client's limbs. So you just relax, okay?
Okay.
So flexion 120, extension 90, external rotation. Centimeters of the table. That's less than 30. That's more than 45. Do you want to lift your leg and move your toes inwards for me? Move these toes in like this. Okay, good. That's 120. Okay, now we're going to do the active movement. Now we're going to do an isometric movement now. So I want you to push into my hands here. Okay, thank you. And I want you to push in my hands here. Thank you. So you're going to be pushing into my hand here. Good. And now I want you to push into my hand here. Good. Push into my hand here. Good. Can you push into my hands here? Into my hands here. Okay. Move your foot into my hand. And into my hand. So I'll do that on both sides. And now just because during my assessment I found that my client has a restricted into his extension and his abduction. So we're going to go into that and get him out of the further barrier. So push into my hand for 10% of your weight for 10 seconds, okay? Relax. %10 of your weight for 10 seconds. Relax. 10% of the weight for 10 seconds. So I'll do that for 5 to 7 times, and I will actually. And on this side, I found his favorite test was a little higher than, less than 5 centimeters. So I'm gonna ask you to push into my hands 10% of the weight for 10 seconds. Relax. 10% of the weight for 10 seconds. Relax. 10% of the weight for 10 seconds. Okay. So I'll do that for 5 to 7 times. So where I will feel the further barrier, so get the patient out of the further barrier. So the next one we're going to do is we're going to do a general osteopathic treatment, and I'm going to ask my patient to relax, okay?
Okay.
So we're going to do a hip circumduction for 5 to 7 times. And then I'll do it on the other side as well. You just relax. Okay, so just during my partial assessment, I noticed my client has a hyperlordosis. So I'm gonna go check his sacrum and his coccyx to see whether they need an adjustment. So you wanna come on your back, on your belly for me, please? So noticing that my client has a hyperlordosis, so the hyperlordosis sometimes can have the sacrum into flexion with anterior pelvic and like the sacrum into anterior protrusion. So we're gonna test this. And I'm assessing his coccyx as well to see what's happening to the coccyx. Here I find his coccyx is fluxed in as well as his sacrum. So we'll do a little bit of adjustment in his coccyx and then into his sacrum. I'm going to ask my client to sit up for me. And I'm going to ask you to come at the edge of the table with your hands hanging on this side. And do I have a permission to go into your underneath your pants but on top of your underwear, like into your hip?
Yes, ma'am.
So I'm going to put my hands underneath his pants but on top of his underwear. I'm going to go deep into it, and my fingers are going to cap like this into his coccyx. And then I'm going to move my patient. I'm going to keep doing this unless I find that the soft tissues around the coccyx is relaxing. And I will do this for at least 5 to 7 times. Okay, so while I have my patient in this here, like the main findings that we found was that my patient had a slight bend on the left hand side and a rotation on the right hand side, which is the indication of a lesion 1 where multiple vertebrae are involved. So we're going to adjust that area for my client. So I'm going to bring and the lesion was actually found in, it's an extended lesion found in flexion. So we're going to do the treatment in flexion. So first I'm going to palpate the area where we found the lesion. So that was around L5S1. So I'm actually going to come from that side. So I'm going to have my client side bend on the opposite direction, and we're going to rotate. Do you want to bend down for me a little? Okay, come into neutral. Okay, come down for me and rotate. Okay, so we're going to do this treatment on my client for about 5 to 7 times till you find a release. Did you find a release happening? Did you find something happening? A little bit. Feeling better?
Yes.
Okay, so that was your treatment for today. How do you feel?
Feeling better.
Better? Okay, so now, like, I'm gonna tell you a couple of things that might happen in a couple days for you. You might feel soreness in the area that you had pain, because we are trying to move that area. Drink lots of water because we have drained a lot of toxins into your bloodstream. And we want to do this treatment for at least a couple more times to see how things go. So if you want to come twice a week for over like 3 weeks, so we can adjust the area and figure out the pain for you.
That's right.
Sounds good? And also if you want to go see a chiropractor, a massage, or physiotherapist, that will also help. A physio will actually help you train those muscles to hold, so that the tension in that area is not building up. So using your proper muscles to protect that area. Sounds good?
Yes, ma'am.
Okay, thank you.
Thank you.